Good day, everyone. Today, we are going to start with one of the most fundamental concepts in pharmaceutics, which is dosage forms. Before we go into advanced topics, it is very important that you clearly understand this foundation because every medicine you see in practice is ultimately a dosage form. So, first, let us understand what a dosage form actually means. A dosage form is a physical form in which a drug is produced and administered to the patient. In other words, it is the final product that contains an active drug along with the other substances, prepared in a way that makes it suitable for administration. For example, a drug like paracetamol is not given as a raw chemical powder. Instead, it is formulated into tablets, syrups, or injections so that it can be safely and effectively used by the patients. Now you might wonder, why can't we just give the drug as it is? Why do we need to convert it into different forms? This brings us to the importance of the dosage forms. Dosage forms are essential because they ensure that the drug can be delivered to the patient in a safe, effective, and convenient manner. Many drugs are unstable in their pure form and can degrade when exposed to light, air, or moisture. Some drugs have a very bitter or unpleasant taste, making them difficult for the patient to take. In some cases, the drug may be destroyed by gastric acid if taken orally. So, dosage forms helps to overcome all these challenges. They improve patient compliance, ensure accurate dosing, and ultimately enhance therapeutic outcomes. Closely related to importance is the purpose of dosage forms. The main purpose is to deliver the drug to the site of action in the correct concentration and at the right time. But this is not the only purpose. Dosage forms also protect the drug from environmental factors such as moisture and light. They help in masking unpleasant taste and odor, which is especially important in pediatric patients. They allow modification of drug release, meaning the drug can be released immediately for quick action or slowly over time for prolonged effect. In some cases, dosage forms are designed to target specific areas of the body, such as inhalers delivering drugs directly to the lungs or topical preparations acting on the skin. Now let us discuss what makes a dosage form ideal. An ideal dosage form should be safe, meaning it should not cause harm when used as intended. It should be effective, delivering the drug in a way that produces the desired therapeutic effect. Stability is another important property. The dosage form should maintain its physical, chemical, and microbiological stability throughout its shelf life. It should provide consistent and predictable drug release so that the same dose produces the same effect every time. It should also be convenient and easy to administer because patient compliance plays a major role in treatment success. In addition to this, the dosage form should be acceptable to the patient in terms of taste, appearance, and texture, and it should be economical to manufacture and distribute. Moving on, every dosage form consists of two main components, the active pharmaceutical ingredient and excipients. The active pharmaceutical ingredient or API is the substance responsible for the therapeutic effect. For instance, in a formulation containing amoxicillin, amoxicillin is the component that fights bacterial infection. However, the API alone is not enough to create a usable medicine. This is where excipients come in. Excipients are the inactive substances that are added to the formulation to support the drug. They do not have therapeutic action, but they play a very important role in the formulation and performance of the dosage form. There are different types of excipients based on their function. Some excipients act as diluents or fillers, which add bulk to the formulation when the drug dose is very small. Others act as binders, helping to hold the ingredients together in a tablet. Disintegrants helps the tablet break down into the smaller particles after administration, allowing the drug to be released. Lubricants reduce friction during the manufacturing process and prevent the material from sticking to the equipment. Preservatives are especially important in liquid dosage forms to prevent the microbial growth. Flavoring and coloring agents are added to improve the acceptability of the medicine, especially in children. So, even though excipients are called inactive, they are essential for the success of the dosage form. Finally, let us look at the factors that affect the selection of dosage form. This is something you will apply in real clinical situations. The choice of dosage form depends on the multiple factors related to the drug, the patient, and the condition being treated. From the drug side, properties such as solubility, stability, and bioavailability are very important. For example, if a drug is poorly soluble, special formulations may be needed to enhance its absorption. From the patient side, age is a key factor. Children and elderly patients may have difficulty swallowing tablets, so liquid forms are often preferred. The clinical condition of the patient also matters. If a patient is unconscious or vomiting, oral administration is not suitable and parenteral routes may be required. The required onset of action is another important factor. In emergency situations, injections are preferred because they act rapidly, whereas in chronic conditions, sustained release formulations may be used to maintain steady drug levels. In addition to these, factors like convenience, patient compliance, cost, and availability also influence the selection of the dosage forms. So, as you can see, a dosage form is not just a simple tablet or syrup. It is a carefully designed system that ensures the drug is delivered in the most effective and safe way possible. Understanding this concept will help you not only in your studies but also in your day to day clinical practice. Thank you.